Hi everyone, welcome to my channel. It feels so strange saying that. I never thought I would be doing a YouTube video, but here I am and I've got a very good reason for doing it as well. So I'm going to talk all about everything to do with lipedema. That is going to be the whole feature of my channel. So for anybody who is interested in finding out more information and also finding out information about surgery, particularly with Lipemedical in Spain, in Madrid, then this is the channel for you. So I'm going to start my first ever video with information about lipedema, about how you can possibly get diagnosed, particularly aimed at people in the UK, because I know that there is obviously an issue with getting a diagnosis through the NHS, so I want to touch on that as well, but just a little bit of information about the disease. So June is actually Lipedema Awareness Month, so I thought what better month to do a video all about lipedema. I'm actually here in Madrid right now, 2 days before my surgery with Lipemedical. I'm so excited and I just can't stop thinking about what the future is going to hold. So I just thought, might as well do a video now and start it off. So first things first, we're going to talk about what lipedema actually is. And it is quite a hard thing to explain. A lot of people understand it, and it does often get confused with other diseases as well, such as lymphedema, which is very well known. There's lots of clinics, especially throughout the UK, that you can go through for the NHS for treatment for lymphedema. However, lipedema is a completely different disease. It is a very similar sounding name, so I can understand why people get the two mixed up, but they are completely separate. So lipedema is a fat disease. It's basically a buildup of abnormal cells of fat. It doesn't respond to diet, it doesn't respond to exercise, so you can spend hours and hours in the gym, like me, and your waist and everything will go slimmer, but your arms and your legs don't change. Obviously lipedema comes in lots of different shapes, sizes, stages, and also types. So it's usually recognised by 4 different types. I am type 4, which means that I am affected from my ankle up to my hips and also my arms as well. However, it affects people in different ways. You've got, the different types, type 1, type 2, type 3, and some people only have it in their legs, some people only have it in the tops of their legs, some people only have it in the bottoms. So it really is very, very individual, and I do think it's very much based on your body type as well. This disease, lipedema, only really affects women. It has been known to affect men, however it is a lot rarer, and it's often linked to genetics and particularly hormones as well. So they would say that, for instance, you would usually see the signs and symptoms with hormonal changes in the body. For me, it was definitely puberty. However, it can also be linked to pregnancy and menopause. A lot of people find that, they have the disease, it stays sort of dominant or even manageable until pregnancy, and then their legs or arms or whatever part of the body that is affected balloons during that time, and they look for a diagnosis then. A lot of people are older before they realise that they have the disease, and it's just not very well known. I think everybody who has this disease knows inside their head that there's something not quite right. You know yourself, you know your own body, and a lot of people feel very much out of proportion, and I think that was definitely the case with me. But also the pain didn't come straight away with me. I've had this disease evidently for years, and I didn't really have pain until recently. I would maybe say the past couple of years, to be honest. So I think the pain is individual as well. There's some people with really early stages of this disease who find it extremely painful, and some people who have really advanced stages of this disease but don't have as much pain. I found that out from speaking to lots of different people on Instagram and doing my own research, but also just from things that my doctor shares from Lipemedical. If you haven't followed him on Instagram, or if you haven't looked at his website, give him a follow on Instagram because his results are absolutely amazing. He was one of the first people that I started to follow on Instagram when I found out about this disease, and he posts loads of really interesting information about lipedema in general, not just the surgery aspect of it as well. So I always forget what I'm going to say. I feel like this video is not going to be successful because I say far too much, and I can't think of what I'm going to say before I say it, and I just feel like I'm rambling on. So I really apologise if I'm boring you to death. Hopefully I'm not. So I think the easiest way to describe what lipedema is in a simplified way is that the diseased fat cells accumulate water, which over time increases the size of the cells, and that's why the limb inflates and looks like it gets bigger, and it also looks swollen and swelled. A lot of it is the water, but over time obviously this puts pressure on joints and nerves and things like that, and that's why you get the pain. For me particularly, I have a lot of pain in my knees and ankles, particularly at the moment as well, after I'd had the flight from London to Madrid, which was only 2 hours, but my leg was so swollen. I was in so much pain by the end of the flight that I had kept moving. I was moving my ankles up and down, but not a lot really does it. I go for a walk around Madrid, and it did sort of release some of the fluid I think that I'd built up over the flight. But manual lymphatic drainage is a good way of getting rid of some fluid. However, there is conflicting information about that, so I do encourage you to do your own research as well regarding that. One of the things that I wanted to particularly talk about on this first video is just the lack of awareness of this disease. I think it's becoming more well known, particularly from people who are maybe of a higher profile who have had this disease. I've actually been speaking to somebody in particular who has actually really helped me on this journey and is such a lovely and down-to-earth person, and I did actually watch her on Love Island. It was Shauna, and I know that she was diagnosed with this disease after Love Island, and I think it was through people messaging us saying like, do you know about this disease? And she obviously looked into it, and she has had surgery as well and had really good results, and people like that are so good to have as our campaigners for this disease because it just pushes it out there a little bit more. And we've also got Zoe, who is Thick Thighs Positive Vibes on Instagram, and her account is absolutely amazing. She is such an inspiration to me, like the way she battles this disease every single day, and it just shows that this disease comes in every shape and size, and it affects nobody in the same way. And I just think there needs to be more awareness about it, because one of the things that this disease does is it makes you feel really, really alone. I honestly had never seen anybody with legs that looked like mine until I went on Instagram and started hashtagging lipedema when I found out what this disease was. And it was just like somebody opened a door and I was like, oh my God, that is literally me. I can't believe that there's people out there that look like me. It was absolutely amazing. It just makes you feel not alone, and the awareness isn't there, so it needs to be pushed more so that people can get a diagnosis. It needs to be more well known within the NHS, and hopefully one day the NHS will fund surgery, because it's not cosmetic. Some people really, really do suffer with an enormous amount of pain, and this disease can progress so far to the point that it actually affects your mobility. You can't walk, you can't do exercise, you can't do anything really. It affects your mental health, so you feel like crap, you feel down, you feel depressed. For a lot of people, they turn to food, put on more weight, and it's a vicious cycle. And I really can understand how it can get to a point where you just want to give up, because it is a really, really awful disease, and it does strange things to your mind. So yeah, awareness. There needs to be more awareness, and I'm really going to push as much as I can to get this out there and get this known. And I'll have started my account, and I've got a few followers. I've got a few people who've reached out to me and just talked about how much it has changed their lives, having somebody else to look up to, the way that it changed me when I first found out. So everything that I possibly can to get awareness out there, I will do it. So as I mentioned before at the beginning of the video, I am having surgery with Lipemedical. So I'm here in Madrid a few days before my surgery, and one of the things that Lipemedical do, and Dr. Burgos in particularly, is they really push for awareness, and it's much more well known in Europe, and I think there's a lot more doctors in Europe who can diagnose the disease. Trying to get a diagnosis in the UK through the NHS is so difficult. For me personally, I had to go private, and then that diagnosis was confirmed by Dr. Acosta, who did my online consultation through Lipemedical. He confirmed my diagnosis, so that was good as well, to have like a second opinion from somebody who is an expert, who has been doing this surgery for years and years. So lastly, I'm just going to talk about the difference between lymphedema and lipedema. The two in name sound very similar, so I can understand why the two do often get mixed up, and quite often when you'll go for a diagnosis, which this has personally happened to me, the UK doctor who I went to see kept referring to the disease as lymphedema, and obviously that is a completely different disease. Lymphedema and lipedema are completely separate, however the two do often get mixed up. So I'm just going to do some differences between the two diseases, just so that we can easily differentiate between the two. So lipedema is a buildup of fat cells, whereas lymphedema is a buildup of fluid only. Lymphedema is usually caused by some kind of trauma to the body. It's often happens to cancer patients, or damage to the lymphatic system. It doesn't affect the two limbs symmetrically as well. It usually happens in just one leg rather than both. However, it can happen in both, and it can also happen in different places on your body, such as your arms. There's currently no cure for lymphedema. However, it can be managed the same as lipedema with compression. The two, I think I can understand why the two get mixed up, because obviously it's an enlargement of a part of the body, such as the arm or the leg, whereas lipedema is a buildup of fat rather than fluid. There is a fluid that comes with the fat which can cause temporary swelling and the legs go up and down. However, the swelling that is caused by the fat is permanent, and there's no way to reduce that, and there's no cure for that either. So yeah, they are two different. I think a fly might have just landed on my head. So yeah, they are two completely different diseases. I think I've covered most of what I wanted to say today. Hopefully it has been informative. Hopefully it's helped a few people who maybe think like, have I got lipedema? And fingers crossed we can raise more awareness together for this disease in the future. And I will come back with another video all about my surgery with Lipemedical next. And I really hope that you will follow my journey, and I would love it if you could like my video and also share it on your page as well. My Instagram name is emma.lipedema.surgery if you want to follow me. Most of you have probably come from my Instagram page anyway, so I really do appreciate you viewing this video. There is a huge siren going on in the background. I really hope you can still hear us. See you all soon. Bye.